Good morning, good afternoon, and good evening to you all, and welcome to this webinar. Today's webinar on meeting the challenges of higher education in Africa. It's part of our series on Africa and COVID-19. My name is Wafai Fauzi. I am a professor of global health, nutrition, and epidemiology at the Harvard T.H. Chan School of Public Health and at the Harvard Center for African Studies. I'm delighted to serve as a moderator for today's webinar. We have three distinguished colleagues as panelists, and I will introduce them shortly. First, a couple of housekeeping rules. Each webinar in our series starts with an update on COVID-19 statistics on the African continent from the Africa CDC. This is the slide that you have seen just before we started the webinar. We are delighted and honored to organize this series with the Africa CDC over the past many weeks and months. After we hear from the panel, we will have a chance to also have questions from the audience, and would ask you to please use the Q&A Zoom function to pose your questions, and we'll be delighted to come to that segment as well. According to UNESCO, enrollment in tertiary education in sub-Saharan Africa doubled from 4.5 million in the year 2000 to 8.8 million in 2016. Over the same period, the rate of enrollment in North Africa has also been steeply rising. Throughout the continent, however, enrollment numbers have not reached the optimal level that are sort of desired by policymakers and colleagues on the continent. And COVID-19 has come and further exaggerated this poor access to higher education. Universities in many countries suspended classes as a means to control the infection. And as many universities are public universities and are residential, students had to travel to outside the region, to other parts of the country. The panel today will discuss the challenges and opportunities for universities in Africa posed by COVID-19, and what role the private sector and governments have in helping to meet these challenges. We intend to focus on aspects related to shifting to a virtual learning environment and contributions of universities to the response to COVID-19. Our three panelists need little introduction as they have been really prominent in this field, so I will be brief. I'll start with Himdat Bayusuf is an education specialist and team leader for the Africa Centers of Excellence in Higher Education at the World Bank in Washington, DC. She focuses on higher education and skills development in Western and Central Africa. Her operational and analytical skills at the bank spans 10 years, where she has led project design, preparation, supervision, and implementation support. She's previously also worked with the Middle East and North Africa region at the bank based in Yemen. Next is Himdat Hamouda. He's a professor of software engineering and has been dean of the Mediterranean Institute of Technology, MedTech for short, based in Tunis since 2017. He has almost 20 years of experience in managing educational programs and professional teams in Europe. And prior to MedTech, he served as an associate professor of software engineering at the University of Gothenburg in Sweden. And last but not least, Zebulon Vilakazi is the incoming Vice Chancellor of the University of Witwatersrand in Johannesburg, South Africa. Congratulations, Zebulon. He serves as the Vice Principal and Deputy Vice Chancellor for Research and Postgraduate Studies at WITS. His research interests include computational physics and is globally recognized for his scientific work as a physicist and for his many contributions towards the development of higher education in Africa. Welcome again to all the panelists. We were hopeful that Dr. Atieno Adala from the US International University in Nairobi would be able to join us. Unfortunately, for personal reasons, she emailed yesterday that she is unable to join, and we wish her well and hope to interact with her in the near future. So let's start with perhaps the big picture around higher education in Africa. Um, and I wondered if we could start with Himdat uh, by helping us frame the discussion with some um, sort of sense of enrollment numbers, investments in higher education, sort of at large in Africa, and how that compares to the rest of the world. So we will start with that, and then we'll follow it up with comments from other panelists with respect to how COVID-19 has impacted that particular story. So Himdat, over to you.
Thank you, Dr. Fauzi. I hope that this works okay. I know that we tried to do this earlier, so my computer is trying to play games on me. Is this okay? Can you see?
So it's okay. Go to the next slide. And if you could, yeah, sounds good.
Okay, great. Thank you so much. So, so thanks everyone, and nice to meet all the attendees. I see over 60 attendees are already connected. So just to sort of give a brief overview for today's session, the main focus is basically on to what extent is COVID-19 affecting the higher education space within the continent, and how are the universities responding. So overall, to give a background, the region is very different. So talking as Africa in itself can also be quite misleading. But for the purposes of an aggregated overview, right now, in terms of just enrollment rates, although there's been a huge increase over the last 2 decades, almost doubling of students within the tertiary education sector, Sub-Saharan Africa is still at 9.4%, well below the global average. But having said that, there are disparities across the continent within, for example, South Africa. There are disparities nationally, but also Kenya and Nigeria and Ghana may have, higher GER rates than what we see. In terms of the actual allocation of government spending within higher education is actually at a sort of global comparative level. We have on average 21% of the education budgets on tertiary education. And if you think of the perspective of this, 3% of the students are within the higher education system. So even in terms of the spending within the national systems per student, you have the basic education sector, which has the most number of students, of course, in the millions, but higher education is still an important part with at least 21% of the education budget. So that's sort of an overall outlook on the enrollment, but also on the spending. There's a whole, of course, other aspect towards the efficiency of the financing and the spending and what these are used for. But primarily at the moment, it's mainly for recurrent expenditure, not necessarily capital expenditures. So going on to the next slide, the World Bank in itself has been quite active within the higher education space. Over the last 10 years or so in particular, there's been a tremendous increase in the support towards countries, both at the national level and at the regional level. So generally, education investments are approximately $5 billion within the bank, and higher education is about 20% of this. And the Sub-Saharan Africa region has about 50% of the total investments within higher education. So that just signals that within the Africa region, higher education is a big part of our support to the countries. And what is even more interesting is there's a lot of innovation within higher education within the continent, in the sense that we don't only support national programs, which are of course very important because they touch upon issues of governance, financing, access, quality, relevance, etc. But there's a new initiatives around regional higher education. So to what extent we can leverage economies of scale, as well as faculty, as well as developing centers of excellence to address regional development challenges, so that you don't have, specialized centers in every country necessarily. Even if we could have the resources, the challenge is that it might not be sort of the most optimal. And it's something that I don't think is new within the continent. It's something that has been done previously, and the bank has come in to support these regional investments, where the universities are supported not only to serve, for example, Ghana, but also to serve the sub-region within West Africa. So, and I'll talk a little bit more about that. And it's something that is very exciting, because we've been in operation for the last 6 years or so, supporting higher education through regional approach, complementing, of course, national programs. And this is something that is almost $500 million that the World Bank has invested in. And it's one of the things that has been keeping us very busy over the last few years or so. So that is just in terms of the financing. In terms of the actual challenges and responses and what is happening, I will leave that for the panelists, and I will come in later to also give some inputs on that as part of the discussion.
Great.
So thank you.
Thank you so much, Himdat. That was very, very helpful and clear. So clearly lots of investment from the bank, from governments, from many other institutions, including the private sector in education in Africa. A lot of that had the intention of also introducing virtual learning as a necessary way to scale up access and perhaps quality as well. And COVID-19 has come really in a way that forced some of that to be tested. So I wonder, sort of hearing from Zebulon and Ahmad, how has COVID-19 affected your institution in your setting in this particular regard? Maybe start with you, Zebulon, and then we can come back to Ahmad and Himdat.
Once again, thank you, Afai, for the kind introduction and for introducing me to this distinguished panel and to the members of the community who are listening. Let me first start by just giving you the global picture of South Africa, somewhat leading from what Himdat mentioned, that COVID hit South Africa around the 21st of March, and that's when the country went into total lockdown, which is almost an anti-symmetry. It's a mirror reflection of what is happening in the world. And numbers are now tapering off, so the level of restrictions have gone down to, the curfews have been lifted, and we're entering into a near normal mode of operation, but we are still running our classes online. South Africa is reflective of the picture that Himdat showed, because if you look at the internal South African dynamics, I won't bore you with history, is that the actual inequalities in South Africa manifest themselves in class and race, and also with our legacy that we have 20 years even after the democracy. And also they're even more acute in the higher educational sector, because the higher educational sector is the ultimate determinant, is a function of one's background, that the middle classes can actually replicate themselves. So when COVID hit and the university went into a complete lockdown and the dormitories and resis were decanted, we found that it was easier. I'm referring here largely to VETs and similar universities in South Africa that have are well-resourced, are globally connected, and have also 80% of their students will come from homes where Wi-Fi, electricity is taken for granted, right? And a significant portion of the students at VETs, and that applies, I guess, if you know South Africa very well, to the universities of Cape Town, Stellenbosch, Pretoria, the usual suspects. But the University of Zululand, Forte, and the so-called historically disadvantaged University of South Africa will have a large number of their students, 90%, coming from indigent backgrounds. So those resources that we take for granted, that the global north takes for granted, even apply within South Africa's inherent inequalities. So therefore, there is that inherent tensions, and therefore as management at VETS, we had to respond and be sensitive to that. So we spoke to tax, the post office, to deliver laptops for free and zero rating of data to students who are living in far-flung areas, who actually, when they left home, they went back to their villages, which didn't have the infrastructure. So that was our first, I would call social justice intervention, because a large number of our students would be able to go online. And also, finally, the role played by the private sector cannot be underestimated. All the tech companies, MTN, Vodacom, Telkom, came to the rescue. They did sign an agreement with all universities for zero rating. The transport and logistics companies came to the party and actually ensured that the devices are delivered. Now, here comes the kicker. A student can have a laptop, a student can have data, and can work from home. But the student might live in a village or might live in a hut with 8 other siblings. That child now is not in the same position as, I would even say, my child, who has his or her own bedroom, right? So I think, and a child of someone living in the northern suburbs of Johannesburg, that I think is something that we worried about. So therefore, we took a action of, again, bringing those students back to campus within social distancing, 1 room per student, food is delivered, there are no canteens. So that actually was another physical intervention that we did to ensure that we level the playing field. And unfortunately, the biggest victims in this case as well were international students, largely from the continent, because VETS and many other universities do draw from the rest of the continent because our borders were closed and we had to let our students go. And they were the victims because now they were in another jurisdiction where the devices now can't work because Wi-Fi and all those devices are a function of a political jurisdiction. So those are the challenges that we are still trying to work around. But with that, I just thought I'd give you a high-level overview of our quick responsiveness when we were confronted by the COVID.
That's very helpful. Thank you, Zebulon, for this overview, quite varied within South Africa and certainly across the continent, and we'll come back to that. Himdat, perhaps your perspective from Tunis, from MedTech, and from Tunis perhaps at large.
Thank you. So hello and warm greetings to everyone from Tunis. So first, I would like to thank Harvard University Center for African Studies and the organizers for the kind invitation and for their efforts in organizing this interesting webinar. So I just wanted to mention that MedTech as engineering school is part of the South Mediterranean University that also comprises the Mediterranean School of Business, MSP, and the Language and Culture Institute, LCI. And what is interesting is that SMU, South Mediterranean University, is the first English-speaking university in the Francophone Tunisia. So let me start with kind of giving you an overview of the COVID-19 situation in Tunisia, like my colleagues did. So actually, we survived well the first wave that was between March and June. In terms of cases, in terms of number of deaths and so on. But then unfortunately, the situation in the second wave, which started just after summer during the months of August, September, unfortunately, the situation has been quite delicate. So we are facing problems in kind of containing the pandemic, right? So unfortunately, the number of new cases on daily basis and deaths, is not yet under control. We're hoping that, with the recent measures taken by the government, the situation is becoming much better. Now, back to the higher education ecosystem in Tunisia. So actually, the higher education ecosystem in Tunisia is quite rich, consisting of public universities and private universities. So from a COVID-19 point of view, probably private universities, have been more successful in managing the crisis compared to the public universities, situation for a number of reasons, right? So, if you would like to understand in a way those reasons, so let's kind of like see together actually the challenges that universities kind of faced actually during in a way the crisis. And I would categorize actually the challenges in kind of 5 actually categories. So first, there was actually an infrastructure problem. So of course, not everyone has access to the internet, computers. The network capacity varies actually. And I'm talking about universities as well as individuals, right? Not all universities are equipped with tools like learning management systems, authoring tools, communication tools. Fortunately, at SMU, we have been like on the happy side. We were ready for it. Many other universities could not actually handle this from infrastructure point of view. The second kind of challenge is a capacity capacity problem, right? So not everyone actually is used to handling courses online, remote like teaching. So we needed to do actually training on innovative and suitable pedagogical methods to meet in a way the requirements of online and remote learning. And here we faced actually as an ecosystem, we faced like the problem of lack of instructional designers that actually would kind of help digitalize the courses. So like it's kind of known, and we have discussed actually even previously webinar, prior to the webinar, that going online is not a matter of actually uploading a PDF file or just like recording actually lectures, right? So here we're talking about innovative scenarios, like different actually models of interaction, different methods of assessment, and so on. So you need like experts actually to do that. The third challenge is actually a regulatory problem. So unfortunately, the current regulations in Tunisia are kind of a bit strict with respect to the to online in a way teaching. For example, the current regulations forbid online assessment, so that's not a possibility. All exams have to be face-to-face, sit-in. Also, there is a limit to the amount of course workload actually that can be given in a way online, right? So the ministry has set like 20% as a limit to the amount of course load that could be actually delivered online. The fourth, in a way, type of a challenge is kind of cultural, right? So culturally, Tunisians are like used to kind of like face-to-face kind of contacts, right? Online and virtual learning is new to us, and actually people would kind of like find it hard to imagine homes as a medium in a way or a venue for class delivery. So maybe actually homes are like known in a way for homeworks, for take home in a way assessment, but delivering like courses while you're at home is kind of like a new thing, right? So we are not used to that. The fifth in a way kind of challenge is I think like ethical and legal, right? So of course, I mean, with the COVID-19, we had to digitalize content, right? And then of course, I mean, this content has to be like uploaded and maybe shared. And then suddenly there are like these like questions of like IP rights, right? So who owns in a way the IP of the content that is actually produced? Is it the university? Is it like the professor? Is it like the student, and so on? And also there has been a kind of have been data privacy issues, right? Of course, I mean, like usually like you have like students sharing in a way their webcams, let's say, right? So and then you have professors actually getting like in contact, virtually with students, right? So like could you share the images, the videos of the students, for example, right? There are these kind of data privacy issues that we suddenly actually needed to handle. So I would say these were, in a way, the kind of challenges, without going into too much details. Fortunately, the private sector has been ready, in a way, to handle, in a way, the situation compared to many of the public universities.
Right.
And that, let me just very quickly jump to the opportunities.
Perhaps, Ahmad, if you don't mind, because many of these challenges are shared, fortunately or unfortunately, they are the same challenges. So you have nicely summarized them, and they would apply perhaps to most countries. And so nicely put. And there might be ways to address them in Tunisia that we'd love to hear back from you and from Zebulun as well. But if I could just pass it over to Himdat to hear from her, how are these challenges in other settings? What's your perspective and experience from dealing with many countries in the region in resolving these? What were the sort of approaches to overcoming these challenges that you have seen? It might be a little bit different from how Tunisia and MedTech and WITS have done, but we'd love to hear from you. Himdat?
Yes, thanks, Dr. Fauzi. So it's very interesting to hear the issues facing MedTech. I think this is addressing almost all the universities across the region and even globally, right? So my sort of approach or how I would lay out is the bank support towards within the COVID response has been around three major areas. So the first is around the relief, right? So to understand, the needs assessment within the higher education ecosystem, how to provide immediate relief in terms of exploring, affordable zero-rated access for education websites for students, looking at remote learning through external platforms, and very importantly, around the technical capacity, both to go digital, the sort of basic infrastructural needs, but also the know-how, the intangibles around, how to teach and the pedagogy of online learning. And then the second aspect is around recovery, because a lot of the universities also closed. So how do we manage students going back to universities, and looking around resilience and ensuring that this whole shock to the system becomes one of the biggest challenges within higher education in the sub-region is looking at access. So how do we look at the massification of higher education in a way that will take advantage of this push towards online learning and finding a way that brings quality and standards towards the whole online learning world. So those are the sort of areas that we are looking at. And one of the things that I'd just like, I don't know if this is the session, Dr. Fauzi, but seeing how the universities have responded, from some of the Francophone universities to Ghana, to Nigeria, etc. It's been very, very interesting, because the first immediate sort of reaction obviously was to close the universities, but it's been interesting to see the approaches that have responded. So, example, University of Ghana came up with a policy on continued teaching and learning, even if the university offices are closed, but identifying ways to ensure that classes was still going on, and looking at how to support the LMS system, etc. So we've seen other places where the students become completely disconnected. So what we've tried to look at is within, and this is within the operations that the World Bank supports. One of the major ones that I mentioned earlier is the Africa Centers of Excellence for Higher Education, which looks at supporting these faculties or departments to within higher education and applied research. And one thing I can say is that the health centers are really at the forefront of the COVID response. within the program that we are supporting, one of the centers, actually now two, one in Nigeria, the Africa Centers of Excellence for Infectious Genomic Diseases, has now been designated as the WHO Center for Genome Sequences. In coordination, I think the only other institution is in South Africa at KwaZulu-Natal, and the HDID Center was the first that actually undertook the genome sequences within the continent. So even before some of the other countries within outside of Africa, the first sample was undertaken there. So that just shows that the scientific capacity to respond to COVID exists. It's a question of supporting it even further. And even the testing, of course, is something that takes place quite regularly. And some of the low-cost, affordable testing is coming out of these centers as well. So in terms of the health response, that's been something that has been really phenomenal and is something that we're very happy on.
That's fantastic, Himdat. And we'll come back a little bit to talk about the response and how universities are contributing to that in a little bit. If I may just focus a little bit together with other panelists on higher education and the virtual learning elements and the challenges that Imad has raised. You raised the point about collaborations across centers of excellence, and the World Bank has been doing a lot in that regard, even on infrastructure and quality of education. Zebulon, I wonder if you could comment on sort of the response from WITS to some of these challenges, and how was it possible? How successful was it? There is a disparity within South Africa. Is there a way to for WITS to support other institutions and benefit from other institutions around curriculum development or around other means that enable virtual learning?
Absolutely. I mean, that's a wonderful question. Obviously, when you are caught with a crisis that comes to you at speed, at light speed, so you gaze inwardly and we try to respond inwardly. So we are now in the moment of trying to build up collaborations with other universities. For example, we've developed, some of our students in our local hospital have developed an app, and that app is now shared. For a screening app is being shared with the other universities that do not have that resource. And in terms of expertise as well, is that as we were confronted by this, we started rolling out LMS systems and so on and so forth. And the good thing about COVID, if I can say, it fast forwarded what we thought, Fauzi, was something that was in the future. We had all the plans for online learning as something to implement in our strategy documents of 2020, 2025, right? So it forced us to respond quickly. And unfortunately, only 10 or so universities out of 26 will be able to finish the academic year on time. But that will allow us now to actually finish our current academic year. Our academic year starts from February to end of the year. It follows the calendar. And some universities might have to extend to March next year. So I think that will be an opportunity for us to now really ensure that we get all our systems in, nationally aligned, that we don't have the similar situation again. But that is, I'll talk more about our responses later, but in terms of the online systems, all universities have been sharing a lot of expertise, but it's a question of now, next year, how do we do that in a more organized and systemic way?
That's helpful. Thank you. Imad, back to you. Just briefly, your sort of response to these challenges around virtual education and 5 challenges that you mentioned, maybe some of them. How has it been for MedTech, and how is it possible to leverage some of these strengths that you have for other institutions in the region, Tunisia or beyond?
Thank you for the question. So, I mentioned about the challenges, right? But then, of course, the COVID-19 has also been like an opportunity in a way, right? And so for us, in a way, I would say that the number one, in a way, opportunity has been actually to kind of speed up, actually accelerate, in a way, the process, right, of like transitioning into like, you know, digital learning. So having said that, and back to your question, in a way, so the way at SMU at large, we kind of handled, in a way, the crisis is, I would say, like threefold, right? So of course we had to think in terms of our like delivery and like operations, like daily operations, right? And luckily, studies have not been actually interrupted even by a single day. So actually, in a few days, like, and it was actually luckily we were like then in the middle of a vacation, right? And when the lockdown actually was announced, so actually immediately in a couple of days, right, we set up actually committees to make sure that, you know, the delivery and the operations actually are kind of maintained. And here I'm talking about like faculty, I'm talking about staff, I mean the administration and so on. So we had to kind of in a couple of days make sure actually to basically run our classes online, as well as like the administrative support functions. So that's in a way the first thing that we did. The second thing that we did is that we thought that, okay, now suddenly we have like too many alternatives. Different people are doing different things. So it looked kind of scary. So we set up actually a committee to basically work on experimentation and like optimization, right? So we would kind of experiment with some tools, right? And then if we find them successful, then actually we kind of like train our faculty accordingly. So it was like more kind of an experimentation and optimization, kind of like, axis, right? And the third axis, and here is like the opportunity, and I mentioned about, is actually setting up a digital transformation actually steering committee. So we set up actually a steering committee that works actually in a way, so or has the mandate in a way to kind of foresee in a way the strategy actually of the university, right? To actually try to kind of be innovative now that like everybody is going actually towards blended learning and digital learning and hybrid learning and so on. So of course that committee helped us in kind of like understanding the business impact actually of the COVID. So it's not only in a way working on the the best practices and the tools and but also like to try to understand the business impact as well, right? So maybe like coming up with new business models in a way, maybe like trying actually to find ways actually to kind of reduce the cost of our operations and so on. So this is how actually in general we kind of like manage the challenges. We set up actually committees, units, task forces at different levels. So delivery and operations to maintain what we are doing, experimentation and optimization to improve what we are doing. And we wanted to relieve our faculty and staff from doing that. And then like more kind of a strategic committee to work actually on more like future in a way plans to be actually what I call like future proof. So I'm pretty sure that COVID-19 will not be the last pandemic, hopefully not, but I think we will in a way experience at some point similar pandemics or similar threats. So we have to be like future in a way proof, right? So in a way, this is in general the way we have handled this pandemic.
That's great, and lots to learn from that approach, really. And I'm sure with more time, we would hear also how BITS has organized itself, and that's really provides lessons for other institutions as well. Maybe, so there are many challenges on infrastructure, on training of instructors, on curriculum content for online learning, and lots of lessons from that I hope can be shared across countries and for the benefit of all. Before we transition to the next segment, I just want to sort of ask, there was a survey recently by the Mawazo Institute that noted that there was some greater gender disparity in access to education and online learning, greater disruptions in coursework and research due to COVID-19, particularly affecting women. I wonder, Himdat, what you say to that? Is that the case? Is that what you hear? And what can be done to ensure that there is sort of gender equity as these responses are happening?
Yes, so I think I've yet to see that particular paper, but one of the things that we are very cognizant of is the affordability question, right? So to what extent do we support students that are already, within the centers of excellence or within the universities that the World Bank is supporting? So that's been a big debate. We actually have a task force that's looking at the various options, and we have to think about the sustainability of whatever interventions we provide, but some of the centers have opted to provide some bundles to some students to have, minimum accessibility. On the gender aspect, I am very curious to see what exactly is the driver. We do know that a lot of the time has been taken away from regular work because a lot of women have had to transition to become more homemakers within the household, given the issues that are coming up. So I don't know if that is a question of access or if it's a question of time of away from sort of studies or work to being a homemaker. So I would be interesting to see that that sort of work. But yeah, the equity aspect is a really big one, and both from poor households, but also in the gender aspect.
That's helpful. Okay, I see many questions are coming in the Q&A, and I will integrate these as we continue the discussion, and those that do not fit in the flow, we will have a chance to stop and address them as well. So thank you so much to the audience for adding your questions. If we could transition to sort of thinking about the response to COVID-19 and what universities and your institutions have done as a contribution to that response. Several universities have already responded in big ways to research, to areas of advocacy, and maybe I would start with you, Zebulon, to hear your sort of perspective from WITS. How has the response been in general? And if you could comment particularly on the element around the trust in science that is really eroding in many parts of the world. There are many conspiracy theories about vaccines that have made it even to South Africa and maybe the rest of Africa. A lot of misinformation about masks and so on. So what's the role of higher education and WITS in that regard?
I think in that regard, I'd first like to give credit to the government of South Africa because as soon as they were hit by COVID, they actually did, the president and the Minister of Health did actually pivot towards science. He said that they immediately established the Ministerial Advisory Committee, chaired by a leading public health scholar, Salim, everybody knows Slim, and leading scholars like Glenda Gray and so on and so forth. And not only were they, it was number one, multidisciplinary. It drew from public health, from the virologist, through our National Institute of Communicable Disease, and also from the data scientists, right? Some of the engineers, for example, at WITS and physicists were helping government with modeling. There've been thousands of models and dashboards. So the dashboard that was developed by some of the physicists at WITS and engineers and data scientists has now been exported to other countries on the African continent. So we've developed an Africa-wide COVID dashboard. Third, the students responded by repurposing their labs for fabrication of PPEs, right? Engineering-proof PPEs. So for a lot of engineers, there was excitement of this challenge. You know, when an engineer gets excited by a challenge, and that was also distributed to the far-flung areas and to institutions that cannot afford. And I think that was primarily the work done by vets and other leading universities in the country. And now on the trust in science, having said that, despite the fact that the minister had this ministerial advisory committee, that really did follow much of the science in their levels of lockdown. Obviously, there were disagreements, you know, there are always these issues. And also, when vets started to join the one of the 3 vaccine trial clusters with Oxford University and AstraZeneca, and there's now another one with Johnson & Johnson, is that there was a huge protest outside of the vets building, main administrative building, by the anti-vaccine crowd, right? So, I mean, those things are there everywhere else. But I think that that is unfortunately how, you know, there is still a culture of anti-science. And I think, Wafai, just before I close, is what made government of South Africa respond and be guided largely. I mean, there were mistakes along the way and disagreements, but largely driven by science, was our experience with HIV/AIDS. So don't forget that we were a country that actually was hit very hard by HIV/AIDS around the late 1990s. And we paid a price by actually, you know, you know the history of that, I think. So I think the response this time around was to show that we will follow science first, and of course, follow evidence-based policy. Not all of it was followed, by the way, but at least 70% was.
I think very clear and helpful, Zebulon. The response at the government level has been clear and strong, following science. The engagement in vaccines by the VITS community has been important. Could you comment on how higher education can influence public opinion around these issues? How are you able to sort of advocate for science and preventive measures like masks? What is the situation within the VITS campus itself on these issues?
I think the compliance is very high, and I think that partially helped. Also because of a strict lockdown and the fact that people lost their loved ones or had their health scares. But you know, just to give just a quick answer to your question on that is that I think that there was a very high level of compliance. I mean, 90% of people were wearing their masks, of course, followed by enforcement, and that was pleasing. One other thing that I wanted to mention is that I am just, because you've got the low science base on the African continent, even in South Africa too, is that I want to see how many of the people who finish their final year at grade 12, what you call the pre-university, will take up science. I think that is the upside, that there is such an interest in science. I'm talking about largely clinical sciences, that I predict that the next big boom in enrollment by top students will be in science. I live in a dream, but I hope that because science was right front and center of this epidemic, I think that there hasn't been any, you know, within the African continent broadly, there was really, we never got caught in some of the political issues around all parties. It was non-partisan, there was that approach. Of course, you'll have the other, you know, outliers out there, but by and large, all the mainstream political parties followed basically and agreed largely with government. So I think, and that I'm not speaking only for South Africa here, I'm speaking also for the rest of the continent. And also, and most importantly, is I noticed the question on social sciences. I mean, the Conversation Africa, I mean, a lot of articles were written by economists, by developmental economists, and social scientists and sociologists and anthropologists on this. So it actually has opened up new opportunities for anthropologists and others to be the translators between the impact of what we do in science on society, on inequality, how do different communities respond. So therefore, it has largely been, in many regards, not a scientific problem or a medical problem, but a social and economic problem. And I think that message has come out clearly.
That's great. And then I'm glad to hear your optimism about the rise in the interest in science, and it's quite promising, definitely, for many problems, not only COVID-19, but for many challenges that the continent faces. The response within the campus at WITS is exciting as well, because ultimately universities kind of are a microcosm of society, and you set an example by what adherence to preventive measures mean, and that certainly is noted by the outside. Imad, I wonder, how is it at your site with respect to the response to COVID-19 and to prevention measures in general?
Thank you for the question. So here, like I'm talking about like the ecosystem at large. What was like interesting actually with the COVID-19 crisis is that suddenly the role of the universities actually has become like very visible. So like on daily basis, you hear about stories about like engineering students, for example, producing, I don't know, smart masks, facial, 3D printed facial, protectors, even respiratory systems. Other students developing all kinds of apps, like applying, let's say, image processing to automatically detect, let's say, COVID-19 cases out of images, or let's say applying natural language processing and AI techniques to handle the COVID-19 calls from citizens. Also, I think professors and our faculty actually have been actually participating together with other scholars to, let's say, build statistical models to predict different aspects of the pandemic. And I have actually inside information that the government used these models in a way to manage the first wave. So I always say that actually Tunisia, managed well the first wave, thanks partially to the contribution of our faculty, of course, together in a way with other Tunisian researchers and scholars. So that is like the ecosystem at large. For us, of course, we had to kind of enforce the sanitary and the safety measures. So we're pretty strict about it. This is like helping, of course, us protecting our campus, and at the same time raise awareness among, of course, our community. Of course, I mean, our community have their friends, their family, and so on. So it's in a way, kind of like it's an indirect message, like to for people to take it, to take things seriously. And we're lucky in kind of like observing actually that indeed, I mean, our community members are on board, so they are adhering actually to the new measures. We are not facing any problems related to that. Yeah, so that's in a way how we have handled in a way the situation like on campus.
That's great. Thank you, Imad. A few questions have come in really about also thinking with respect to how to prepare for the next threat and how to make the most out of the current interest that Zebulon has mentioned and all of you have mentioned in science, from government, from the private sector. So perhaps a question to all three panelists. I'll start with Himdat, and then Imad, and then we end with you, Zebulon. What are the ways to sort of maintain this interest that society has in science? How can it be sustained beyond COVID-19 to build those sort of resilient higher education institutions? From two perspectives, at least. One is from the sort of cost perspective and investments. And you can comment from government's investments, ministries of education, and the private sector. And several questions refer to that. And secondly, from the perspective of bringing a number of sectors together. One of the questions refers to, it's a little bit too silent to think about health separate from the environment, separate from business, separate from agriculture. Is there a vision to use this also to bring various sectors together and enhance quality of education in a holistic sort of cross-cutting way. So over to you, Himdat, first.
Okay, thanks, Dr. Fawzi. So if I understood correctly, so to what extent can we continue the attention and interest within science? And how do we, so one of the, I think the most important thing I think is utilization of the education, right? So the more you can apply the research that is happening within the universities, the more you can engage the youth and the students in finding solutions, in the whole awareness campaign and being involved in the community campaign and awareness, right? So from not only within your corridors of the university, but involved at all schools in the country, at all hospitals, at malls, at shopping places. So where the students are part of the, be it testing, be it campaigns on responding to COVID or whatever the major challenges, the more absorption and the more interest there is. And of course, the use of social media and communications there. So just to sort of, I've seen some of the questions that have come up around the silos question. I think maybe I had communicated the work that's being done by the centers in training of health workers, in training, in the outputs that is coming out from the research is very integrated in society, right? Not only, for example, working closely with the Ministry of Health or et cetera, but also working where there are large communities of elders, et cetera, integrating the short-term course training to caregivers, to nurses, to all facets. And it's not only what is done in a lab. So that is not what is taking place. It's very integrated, and a big part of the ACE model is the multidisciplinary, multi-sectoral approach that comes through. So I hope I answered that question.
That's really helpful.
Yeah.
Great. Thank you so much, Himdat. Maybe, Imad, your thoughts in 1 minute, and then pass it over to Zebulon to close us out.
In 1 minute. So again, like, I think people have realized that it's only education, it's only research, it's only science that could save lives. So we can only enjoy art, culture, football, sports, wherever, if we are physically fit, if we are mentally fit, right? So it's always worth investing. It's always worth funding research and science. The way I see universities in the future, I see universities as a keystone actor in an ecosystem that brings together different kinds of actors, right? And we are seeing actually new suppliers actually to universities, new clients actually of universities, and I think we need to kind of maintain this momentum for the benefit of our citizens, for the benefit of humanity.
Thank you so much, Imad. Zebulon?
I think Imad has covered significant ground, so I'm glad for that. So I'll not repeat what he has covered, but I think to summarize in one minute, I call it the rule of the cortex over the limbic, the rule of reason, right? The rule of facts over opinion. What is scientific thinking? And by that, I don't mean purely scientific thinking in the narrow natural sciences way, but the scientific thinking is follow facts and use facts to decide. Don't follow anecdote and let this be, your raison d'etre of how you think. And I think that the profession that most of us who are here are involved in, we are in the profession of the mind, the profession of thought and reason. And I think if that's the lesson you've learned, picking up from Imad, is that people must follow, facts and not be immune to facts. And when facts say that there's a causal link between A, B, C, and D. It's not because it's an opinion. It has gone through a process of rigorous thought. And that's all I want to say.
Thank you so much, Zebulon. I think all of you have shared really wonderful examples of how the challenge has affected your institutions. Many solutions that have been put forth. And there is a lot of optimism that I sense really from each of you about the future, and I share that with you. One clear opportunity is also the opportunity to share these lessons with others across the continent. There are lots to learn from each other. There was a note in the Q&A also about the role of the northern institutions, and I'm sorry we didn't have a chance to get to that. Maybe that could be another webinar, but I would say that there is a lot of enthusiasm also at Harvard, at other institutions in the north, to partner with you at African institutions, to learn from you and to share any perspective and experiences that we have. So thank you so much for sharing your lessons, and we look forward to continued interactions. All the best.
Thank you.
Thanks.